to the first video of our core and pelvic floor fundamental series, Breathing 101. I'm so glad that you're here. So first of all, why do we need to learn about breathing? Well, when we're pregnant and postpartum, a lot of times we create what's called a paradoxical breathing pattern to make room for the baby. And then this pattern sticks with us into postpartum. And that is when our shoulders come up by our ears and when we take a nice big breath. So for example, that would look like this. And that's exaggerated. But the point is, that's not how we want to be breathing. Or another common compensation is belly breathing, which is what it sounds like when our breath just goes into our belly. And it looks like this. So neither one of those are effective breathing patterns, and let me tell you why. So our core is a pressure canister. We have the diaphragm at the top and the pelvic floor at the bottom, and they need to work together to function properly to help things like pelvic floor dysfunction, leaking, pelvic organ prolapse, diastasis recti, anything like that. And so we have the diaphragm and the pelvic floor. And for an effective breathing pattern, when we take an inhale, our diaphragm and pelvic floor expand slightly on the inhale, and on the exhale, they have a natural recoil. But as I mentioned before on those other two breathing patterns, that is interrupted and our pelvic floor doesn't get the expansion that it needs for it to be a healthy pelvic floor. And so really, learning to breathe with an effective breathing pattern is the first step to pelvic floor health. So, what does an effective breathing pattern even look like? Well, I like to call it a 360-degree breathing because that is exactly what it is. We want the air to go into our lungs and come down and out in all directions in a 360-degree pattern. Some of the women I have worked with have told me that it kind of reminds them of a balloon being inside of their abdominal cavity being blown up with each exhale. And so that's kind of what we're aiming for. Our ribs expand with each part of the exhale or the inhale, our back expands, our belly expands, and our pelvic floor expands. So let me just show you a couple times what that would look like. My shoulders are not going up. I'm feeling it in my pelvic floor, which obviously you can't see. My ribs are expanding to the sides and to the back. Okay, so that's what that looks like. Now let's practice a few exercises to help us kind of get the hang of what this is supposed to feel like. The first exercise I like to do just involves a couple of towel rolls. So put one under your head, one under your side here, and just get nice and comfortable. You're going to come into a C shape here and make sure your ribs are not arched out like this. They kind of just want to be in and your back is rounded. We're going to put our fingers around our ribs here and then our thumb around the back. And we're going to take some inhales into our back, into our pelvic floor, into our ribs. You should feel your ribs and back expanding with each inhale. So go ahead and take a few breaths with me. Inhale. Exhale. Inhale. Exhale. One more. Inhale. Exhale. Okay, now let's move on to the other side. And if this is tricky to feel, that's okay. Just keep practicing. It's important for us to practice on both sides because often we have one side which is tighter than the other, and we really want to make sure that we're getting our body equally functional on both sides. So go ahead and put fingers around here, thumb in the back, C shape, make sure your ribs aren't jutting out. Go ahead and take some inhales with me. Inhale. Make sure that shoulder isn't coming up. Feel it in your pelvic floor. Inhale. Exhale. Good work. Okay, that is one of my favorite very beginning exercises for learning about breathing. So do that as much as you need to. Our next exercise is going to be here on the ball. If you don't have a ball like this, don't worry about it. Just find a couch, something that's soft and can give you a little bit of feedback on your pelvic floor. So we're going to do the same thing. Put our hands around our ribs here. Find a nice neutral pelvis. We're not overly arched. We're not tucked. We just have a nice neutral pelvis. And we're going to take some inhales here. Feel for the feedback on your pelvic floor. Ready? Inhale. Exhale. Inhale. Exhale. One more. Inhale. Exhale. All right. Great work. We are done with the ball here. Our next exercise is going to be a deep squat. Now, if you can't do this, I'll show you a modification in a minute, but you can use anything. It doesn't have to be a weight. It can be the leg of the table, whatever's sturdy. And we're going to hold on to this weight here, round your back. The goal of this exercise is to feel your breath come into your back and pelvic floor. So if you're not pregnant like me and you want to block off your belly a little bit more, that's great. That is actually very helpful. So go ahead and take a nice inhale here. Round your back. Inhale. Exhale. Inhale. Exhale. One more breath here. Inhale. Exhale. All right. I said we were done with the ball, but let me grab it. We do need it for that modification. So if you can't get into a deep squat, no problem. I want you to just lean over a ball like this or something else, a pillow cushion, whatever you have that will block off your belly for you, and just come here and take a nice breath into your back like this. Inhale. Exhale. Inhale. Exhale. Okay, so that's your modification if you can't get into a deep squat. All right, our last exercise is just lying on our back here. So a lot of times when we have that paradoxical breathing pattern, when we lay on our back, we will breathe and our back will come away from the floor and our ribs will arch up. And that will look like this. That's not what we want. So we're going to put our hand under our back right here to feel our back expand towards the floor on the inhale. So go ahead and take some nice breaths for me. Inhale. Exhale. Inhale. Exhale. So we want our breath to go equally in our ribs, our belly, our back, and our pelvic floor. So take a couple more breaths with me and feel for that expansion. Inhale. Exhale. All right. Good work. So as you learn this new breathing pattern, I want you to find a consistent moment in your day, every day, to practice this for 2 minutes. 2 minutes, that's all. 2 minutes every day, whether it's when you first wake up, before you go to bed, right before you brush your teeth, right when you're done exercising, whatever works best for you. But I promise you 2 minutes of consistently practicing these things will get it cemented into your brain eventually. So you don't have to have your breathing pattern perfectly down pat to move on to the next video. Please move on to the next Pelvic Floor 101 video because this breathing pattern can take several months to learn. I know it took me that long. I mean, several months to learn. And so don't lose hope with yourself. Be patient. Just keep showing up consistently for 2 minutes a day. And I promise you, you will learn, especially as you move on to other things, that will help kind of, oh, okay, give you an aha moment of, that makes sense. Okay, I feel that here. So don't stop moving on. Don't get stuck. Just be consistent and keep moving on. So if you have any questions, feel free to comment below, or you can always reach me via DM over on Instagram or Facebook at Small Simple Strong on both of those platforms. I am more than happy to answer any questions you have. Nothing's embarrassing, nothing's weird. I am absolutely happy to help you. So I hope to see you next time in the Pelvic Floor 101 video of our Core and Fundamental series. We'll see you there.